Good morning, and thank you very much for joining us. I am Yori Folarin. Just as the president said when he spoke to the nation on Sunday, he put in the restrictions, but did say that these would be reviewed from time to time. And indeed, we're beginning to see some of those reviews. States across the country are beginning to, open up windows following reactions from the public, and no doubt their study of the situation as well. But first and foremost, I'm here with my colleague Asukwa James, TVC News assignment editor. Good morning, Asukwa.
Good morning.
It's tough. It is what it is. It looks like, if on the one hand, it's something of a conundrum, by which I mean that the idea worldwide is stay off the streets. You couldn't be more clear. But in our locale here, we've been hearing from our people, government itself has been making observations and has been making arrangements. And so there's a compromise of that, such that there will now be windows open, right?
Yes, exactly. Just yesterday, the federal government actually decided, to give like a 4-hour window for people to, rush to the markets and maybe supermarket too, to get foodstuffs and essentials. But to me, I don't know, it's becoming...
And one moment, please. In Kaduna also, the news came through that I think every 48 hours,
yes,
the market would be
open, and that was that was the initial plan of the Lagos State government, whereby the neighborhood markets would open every 48 hours. And I know, like a particular market, the My 12 market, they started their own mobile market, bringing it down to your streets. What you need, that is the perishables that you need, so that you don't
so that
need,
was real?
Yes,
that was actually real?
Yes, it started yesterday.
Okay.
And you don't need to go to My 12, so they can bring it to your streets or to your estates, depending on the number of people. And it's been working until we now saw this 4-hour window for people to always go to the market and the supermarket.
Well, fortunately, we'll be speaking with an official of Lagos State, in fact, the Lagos State Commissioner for Agriculture. In Lagos State, as you know, they have set up emergency markets in schools. We'll be talking with we'll be speaking to the Honorable Commissioner of Agriculture, who, he's key to all of this. But before then, let's look at a package that we put out earlier, a package by Celestina area, on the conditional cash transfers to poor households, because everybody's been asking, where's this palliative? We're hearing that in America they're giving them 80% of their salaries.
Exactly.
In Britain, giving them 80% of their salaries. Where is what you will do for us? Well, let's listen to Celestina's report.
Kwali is an area council in the Federal Capital Territory. Gathered here are over 1,000 indigents from this local government to receive the conditional cash transfer, which is money from the returned Abacha loot. The aged, pregnant, nursing mothers, youths, and adults stand huddled together under the scorching sun, paying no heed to the policy of social and physical distancing. Although, when they finally gain entrance, they are asked to wash their hands in a makeshift tap made available. Then the money is handed over to them.
We are working with the Ministry of...
The Nigerian president, in his speech, delivered on the 29th of March 2020, directed that the conditional cash transfer should be given in advance of 2 months to the poorest and most vulnerable households in the country.
It is a very long process. Many people are involved, community leaders, religious leaders, different groups, the council chairman and his council members. They all come together and identify the poorest of the poor and vulnerable households in that particular community.
We have a structure of payments which is through the payment service provider, and we have pay points at each ward. So it's not cumbersome. We have been doing this for over time. It's just the volume of the money they are getting this time around that has increased based on the pronouncement of the President of Nigeria.
Some beneficiaries expressed appreciation to the federal government.
Thank God, all the time when they used to give us this money, we are eating inside the money.
A civil society organization also took part in this exercise in monitoring the activities to ensure that the most deserving gets paid. A press statement was later released by the civil society body based on the observations. They commended the federal government for responding to the needs of the poor. Late General Sani Abacha, who ruled Nigeria between 1993 and 1998, is believed to have diverted over $4 billion from the nation's treasury. Over the years, recoveries have been made of these stashed away funds, with over $1 billion returned so far. 904,000 will be dispatched here today, and each beneficiary will be going home with 20,000 naira, which is part of the conditional cash payment meant for the poorest of the poor. It is to serve as a relief as the country is battling with the ravaging coronavirus. Celestina Area, TVC News, Abuja.
Okay then, thanks to Celestina for that report that went out earlier. I don't know if we have on Skype Aliu Abdullahi. I think we now have the commissioner that I was telling you about, the commissioner in Lagos State, the commissioner for agriculture, Prince Bala Lawa. Good morning, Prince Lawa.
Good morning, Mr. Folarin.
Thank you very much for joining us. Could tell us a bit about the program, because we were just saying in-house here that we seem to have a conundrum on our hands. On the one hand, we know it's best and safest for people to not come out at all, but on the other hand, we realize the practicality of our situation. We hear that you're going to set up emergency markets in schools, in certain schools. Could you tell us about that, please?
Okay, thank you very much. The main reason why we set up the... Am I audible enough?
Yes, we can hear you.
The main reason why the governor, Mr. Babajide Olusola, set up the neighborhood market or makeshift market is essentially to reduce the burden of trips that our citizens will have to make. We want to see how we can reduce the trips. And we don't want, since the public transportations are no longer functional, we believe that if we set up a neighborhood market where you have to walk less than 1 kilometer to the market from within your neighborhood, you will be able to have access to the food. And also, we believe it's not everybody that has the capacity to bulk purchase food items and stock at home. There are some people that cannot buy more than 1 deca of rice. So we have given them the opportunity to be able to be coming out. So that is why we are able to manage the lockdown burden that Lagosians are currently. So in all, we have 26 neighborhood or what we call makeshift food market across the state.
I'm taking it for granted that
is on the...
Okay, Commissioner. I am taking it for granted. I'm taking it for granted that government will still want to pay scrupulous attention to the, health situation and the risks that are attendant with what you've always been, teaching us. That look, maintain, what is that thing? Social distancing, because there's a way our people go to the markets. Is that going to be addressed so that safety is not compromised?
That's already in effect. We have started the enforcement and the implementation by ensuring that nothing less than 10 people come into the market. And we ensure that by the time you're coming in, we check your temperature, We have our officers there. Then we also ensure that you wash your hands with water and soap before you gain entrance to the market. And social distancing is what we enforce. We have other law enforcement agencies working with the Ministry of Agri to ensure that we have a full compliance in the food market.
Excellent, Commissioner. That is in terms of accessing the market, but
that's accessing the market.
Yes.
Yes.
You said that you're gonna make sure that no more than 10 people are in the market at a time. How about the people outside? Because queues, again, with a safe distance, will have to be maintained while they're waiting their turn to enter into the emergency market.
You know, the markets, we always ensure that we start it as early as 8 a.m. until 5 p.m. So you don't have to rush to the market. You can always take your time. It's within your neighborhood. It's like it's normal grocery market, you know. And we expect that we will be civil with the way we do things. And the last one we had, which was on 29th of March, it was, you know, and the schools that we chose are where, you know, where the facilities are big enough. So there won't be any way of, you know, struggling for space, you know. We use the school, the football pitch of the schools. So very massive. If you go to Ogudu, Ojota Nursery and Primary School, very massive. So also Ikeja Primary School, somewhere in the GRA, also very big enough. So social distancing guidelines will not be a problem there.
Okay, thank you, Commissioner. I am here alongside my colleague Asukwo James of TVC. He has a question for you.
Yes. Honorable Commissioner, I know that about 50, you've already dedicated like 50 points or schools where this market will be located. But there are some people like Nekwe, Agbowa, I don't know if they have points, because there are some complaints we got like yesterday that they don't know where this neighborhood market is situated.
Okay, for Ekpe, it is our belief that there is no way we can set up market in all the local governments and in all the LCDAs. So for Ekpe, the location is at Teresa Roman Catholic Primary School at Okoimbo in Ekpe. And that is the only place we have the market. Don't forget the fact that Ekpe is more like, is an hinterland. A lot of people still have the opportunity to move to their farms to get. So we are also mindful of the fact that where we have an existing food market, we do not set up our own neighborhood market there, because food markets are not short entirely. So that is for the situation of Ekpe.
Okay. Commissioner, this effort, this effort that Lagos State government is putting up, it's certainly the people will appreciate it and it will bring some succor to them. But could I ask about other markets? Because you just said there that where there are other markets, and these markets no doubt have to fit into the description of those that are allowed. It has to be food, emergency supplies, food, medicines, that kind of a thing. How about stores, like in Lagos? I think everybody in Lagos knows ShopRite, for example. Will those kind of places be allowed to open amongst others?
Because of the congregation, the gathering of people, if they can enforce, I want to believe they will be allowed, but it's always difficult. And that's why we set up the number of people that will have to come to ShopRite. Once they know that there is a neighborhood market that they can buy their grocery or food, they will be able to, they won't have any need to go to ShopRite. You understand? Take for instance, Surulere. We have 4 markets in Surulere. 4 markets in Surulere. You know, so there's Sijuade Primary School at Odoluwo Street, Jeshatedo. We also have Lagos Progressive Primary School on Imba Street, Surulere. We have Obele Secondary School somewhere in Lawansin. Then Aguda Primary School on Brown Road at Aguda. Those are the 4 schools and markets that we have in Surulere.
Okay. Now, the time frame again that you gave us at the beginning, Mr. Commissioner, people can go and try and access these markets between how many hours did you say, in the morning to the evening?
From 8 a.m. to 5 p.m.
Okay. I just wanted to be sure from you, isn't this compromising the whole idea of a lockdown? Because, you know, we are hardwired as human beings to socialize, yes. So people want to do that and people are complaining. But now that they have from 8 to 5 p.m., how are we to know? People might, as you probably might have heard yourself, Mr. Commissioner, kids are playing soccer in the streets. It's been taken like before. Are you concerned at all that almost indispensable as this effort is, it could also compromise the efforts of our health workers?
We want to assure Lagosians that we will make sure that we do not compromise the health of our workers and the citizens of Lagos State. The last one we had on Sunday 29th, it was well monitored. We had our health officials there. We have our own Ministry of Agriculture team there. Then we also have law enforcement agencies there. So we are going to scale up if we have any cause to do that.
Well, I want to thank you, Mr. Commissioner, for coming on, and also, thank you for your efforts, as you said, to bring some soccer to citizens of Lagos.
It's also important to let you know that
yes,
it's
please.
Not a daily market.
It's not a daily market. How frequently?
It's not.
How frequently? How frequently is it? How frequently?
It's every two days. Every two days or three days. That's what, depending on the location. So the next one is on Friday.
Okay. You said depending on the location. So between 48 and maybe 72.
So for Friday, the market will open on Friday, so that whatever people must have bought that is being exhausted, they can come out again to buy some more and go back.
Okay.
So there are different homes.
Okay. Well, again, just to say that again, that actually it's going to be, because I was just saying that Kaduna had sort of said that it'll keep the markets open, it'll open certain markets every 48 hours. This in Lagos is similar to that.
We are not following the Kaduna model. It's our own model that we're following.
I appreciate that.
So it's Lagos model.
But okay, if you want, let me take Kaduna out of the equation. In Lagos, every 48 hours or 72, as the case may be, if I'm quoting you correctly, there will be markets for people to come to.
Yes, the 48 hours, that's the design. But in retrospect, we found out that 48 hours difference will not be effective enough, because we have to consider the farmers that are bringing their produce, the logistics, and we don't want the prices of the goods to be higher than the market price, the original market price. So we don't want a situation whereby they will have to say, because of logistics, we are increasing the prices of food items.
Okay, there's very little that you can do about. We hear that people are profiteering. People are, people going to the market are complaining that things have become inordinately expensive. I suppose maybe your correct pricing might force things down. Is that the idea?
Absolutely. I believe so. We will ensure that the prices are not out of place. Competitive prices that are not above the market price before the lockdown. That's what we ensure.
Okay, maybe one last one, Mr. Commissioner. You've made these arrangements for Lagosians to come around, especially those that can't afford to stock up for a month or two, as the case may be. You've made these arrangements. But how about the wherewithal? How about the money, the cash? As you know, people are saying that is government not going to come across with some grants?
Yeah, that might be a challenge for some homes, which we understand. But government of Lagos State has come up with an economic stimulus package for indigent communities and elderly and the vulnerable people in our society. So with the economic stimulus package in form of the emergency food response, that is another way of reducing the burden, the lockdown burden on
Mr.
our
Commissioner,
citizens.
Mr. Commissioner, I'm talking about cash.
Yeah, I know. We have come up with another model what we have come up with. If we are not giving out cash, which we are not, we don't foresee, we have provided food items for 200,000 households at the first instance.
Okay. So no cash for the moment.
So if they need to buy, they will not need to buy more than necessary.
Okay. But still, no cash can be expected. But it will be made as easy as possible by your palliatives.
Yeah.
I want to thank you very much, Mr. Commissioner Prince Lawal, for coming on the program.
Thank you very much for having me, Mr. Ayori.
Thank you, sir. Okay, so there we go. For now, because the authorities say that these situations are with us, but that they will be reviewing them from time to time. But for now, as the commissioner has explained, we can't figure too much about money. We will bring in kind. You know how people sometimes say whatever you can give in cash and kind. I think Lagos government is concentrating more on the kind. But there are other areas where we see cash.
Yes, I think that cash is still going to get to some areas in Lagos, because I know we have like almost 11 million registered poor people in Nigeria, as in the vulnerable.
In
the federal government, yes.
Indices.
Based on the indices at the Humanitarian Affairs, based on their own register. And about 2.6 are poor. But we have 11 million, but 2.6 are poor. So what they will be doing will be to get to all the communities, all the 447,000 communities across the 36 states, including the FCT, to try and hand this cash across. Because I know in Kwali, they've started in Kwali, and just like my reporter said, about 900,000 has been given out. So it means it's still going to come to Lagos, and they will definitely go to that community. That is the federal government cash this time around, since the Lagos state is giving out kind and not cash. So Lagosians should, wait till the federal government cash comes. It's not that the federal government knows that you can't just tell people to go to markets without cash. They are giving people a 4-hour window to go to the market to buy stuff. So it means that you have to give them money for them to go to the market. And then, just like the commissioner said, along with that one, if you have cash and then the local state government is giving you a little bit of kind, you should be able to take you through for the remaining, for the 2 weeks that you'll be at home.
Now, these arrangements where we are getting relaxations of the initial position, which was following best global practices.
Exactly.
That, look, stay indoors. You can't afford to even potentially be able to catch the disease or be able to transmit it. But this has had to be modified in the lights of practicality. That, look, this place is not China. This place is not UK. It is not. It is what it is, and we have to think global and act local. And I think
exactly.
I think that's what we have on our hands now. Thinking global. We know. We see all the fumigations going on around the world. It looks like a science fiction movie. Fine. We also are doing our bit locally. But this relaxation, I guess it's a trade-off. Government must have studied it very, very seriously and seen that it has to be a trade-off. Otherwise, it's been said that hunger might kill you, quote unquote, if Corona doesn't get you. But it's really, I think, for governments being between a rock and a hard place.
Exactly. I'm looking at it from two different perspectives. The world over, they are talking about complete lockdown to deal with the virus.
Yes.
But we are saying lockdown, but people don't want to lock themselves.
That's right.
Down. They just, because even the 2-3 days that they started the lockdown, people are still going out,
Yes.
walking. So people are not even indoors. Now the government is also, perhaps the government is also looking at, what if we, because they would have sent some men, their intelligence officers out to feel the pulse of the people. And frustration would have started setting in most states and most communities. That, okay, we don't have money and you want to put us, you want to lock us indoors. So definitely, I think that is where the 4-hour window comes out.
Yeah.
But we are also trying to endanger ourselves
exactly.
order.
Government is yielding. I don't know, perhaps necessarily to the situation that we find ourselves in, by which I mean that the kind of responses we're getting from our cameras that go out on the street, it's like people are in denial and are saying that, look, they have to go out. You can't leave us like this. It looks like they've sort of taken for granted that, in the first place, I'm immune to this. They're not saying that.
Exactly.
But that seems to be what is in the back of their mind. Because if anybody felt that I could catch something that could be potentially lethal, then the gusto and the vigor with which people are saying what they are saying, which one can understand, might be different. We got to go on a break now. Let's go on a break. We'll come back. We still have more people. We'll either get you on Skype or on the phone. And of course, we'll also take the telephone calls that come from home as well. Stay with us, please. Okay, welcome back. We still are in a lockdown, but now it has become a lockdown after a fashion. And by the way, it's supposed to be Lagos and Abuja and Ogun State as well. But now the situation we have on our hands, government, of course, reacting, redesigning, that kind of a thing. The lockdown is not quite as tight as it used to be. It's a worrisome situation, and we were just saying before going on break that government must have weighed all the odds. In fact, our Esther Omopariola, she has a package, a report that is on new rules that the Presidential Task Force is engaging with.
While President Buhari issued a 14-day lockdown in 3 major cities, many state governors have also ordered strict restriction of movement within their domain. This measure is to enforce social distancing and limit the spread of the virus. The Presidential Task Force on COVID-19 has taken the effort further by outlining basic principles of hygiene which should be practiced in stores, supermarkets and banks and other essential services during the period.
Staff and customers attending to supermarket and food stores must wash their hands before entry to the store. Owners must make provision for regular hand hygiene for staff during working hours. Store opening hours shall be between 10 a.m. to 4 p.m. daily for customers. At any point in time, the total number of customers inside each store must not, on average, exceed a third of the store's maximum capacity.
All food stores and supermarkets are now expected to be opened between 10 a.m. and 4 p.m. each day. With regards to road movement, the Presidential Task Force called on transporters, where permitted, to ensure adequate spacing between passengers and ensure the passengers frequently perform hand hygiene. Minister of Health says everyone is at risk of contracting the virus and should stay at home. And the Minister of Interior says the ministry is working with states to ensure the cases of inmates who have been held on minor offences are dispensed of quickly.
even if you created a vaccine today, it has to undergo trials. It has to undergo clinical trials to make sure that it is safe to use, because a vaccine is not only to prevent you from contracting an illness, it's also to be sure that the vaccine itself doesn't turn out to be an illness. So it doesn't turn out to be something that harms you. So a lot of clinical trial that must be done to ensure that it is safe and that it works.
More than 80% of the inmates in the awaiting trial group are from the state. They are state offenders. So we are therefore working with the state government along with our own system to break down the profile, basis of incarceration.
In the meantime, the Secretary to the Government of the Federation appealed to Nigerians to abide with the restriction order and also asked law enforcement agents to desist from applying excessive force.
You need to deepen that in the minds of our people, that this is not the time to travel anywhere, for your own good and for the good of the people that you are even going to. This is the time to stay put.
Director of the Nigeria Center for Disease Control says more than 5,000 persons have been traced using a digital dashboard in the Emergency Operations Center. Esther Mokwariola, TBC News.
And thanks to Esther for that report that went out earlier. I guess there are those who are trying to still wrap their heads around the situation we have on our hands, where we've just finished listening to the health authorities, and most people know. We agree that not everybody has access to, media, digital media, and can see what's going on around the world. But there's a conundrum now because the markets. There's no how you're going to be able to be 6 feet away from the next guy, maintain that social. I just, it's a situation. So I guess it comes back on the individual citizen that he owes himself the primary duty to be as safe as he can. I was speaking about kids playing in the school, on the streets. Now a lot of people will feel a relief that, now government is listening. Now we can go out. This is the way we feel normally. I don't know.
See, these new rules are no rules at all. They are no measure for us to deal with this virus. It's like we are just going back to how it was before the president's address.
But what to do when people said, I don't have money to stock up for 1 week?
I think what they would have done, or the federal government would have done was, okay, we are going to shut down maybe in 4 days' time. And so if the federal government had money to give, if they had monies to give, they should have given. If they had foodstuffs to give, they should have given in that 4-day period or 1 week period. Okay. So that we can now do the proper lockdown.
Okay. One moment, please. I understand we have a call coming in from Abuja. Hello, good morning. Good morning, Benga from Abuja. Okay, you're on now.
Yes, Mr. Yorin and the lockdown has to be customized to our own particular situation. There are a lot of things here. Yes, I thought you are question. I think our own lockdown has to be customized to our own situation. We cannot do the way they do in Europe, where if there are institutions, there are systems by run, but we can get everything we want by ordering online and deliver at your home. The situation we are here, when you know the young children, they need to survive by means of feeding. Like myself now, I'm in a home. These are people are allowed me to eat from the past, but my director is running down as well. The oil is going down. need to do some relaxation for us to assess those things necessary for us to make sure that a lockdown is not even a bondage, it's not a stopping to us. I think we can even exclude it. Yes, we are not going out, we are not in our business, we are locked down, but last people in, we are hoping to use it to get a benefit out of it. So that's why the government is looking at it that let's take us to our own position to see that even though we are locked down, our citizens are still able to have a fulfilled life. They're able to access necessity of life. See that will make life better for them.
Yes.
That is my own.
Okay. Thank you very much, Gwenga. Indeed, well, Gwenga makes the point, and he makes it well from his own point of view.
Yes, he said we have to do what we call our customized.
Yes.
You know,
so whereas we are customizing, as Gwenga is counseling, how we go about our lockdown, the point must not be forgotten that the virus itself is not customizing.
It's not customized.
It's as potent as it is in New York.
Exactly.
In Elasamaja.
Exactly. Because
and this is a problem.
I'm very sure before today ends, it's going to clock 1 million confirmed cases. And the deaths should have clocked almost 50,000 deaths.
So this is the problem that
know,
we were referring to, where government finds itself between a rock and a hard place.
Yes, exactly. So that is what, like I was saying, if we knew that, okay, we wanted to lock down, give everybody 4 days, let them stock up, let them get all the monies they wanted to, let them, then they start serious sensitization across the nation. The NOA is like it's not existing. So the state government should have, there are some state government that were not even existing, as far as I'm concerned. Just recently, just yesterday, Akwa Ibom had 5 cases. And this is a state that actually had a partial lockdown. But eventually they now had confirmed cases. So if the federal government wants to either lock down, we have to make it we have to make sure that it's complete lockdown. But let's give everybody that window. Now we are opening up everywhere. Buses. I remember when the Lagos had about 13 cases or thereabout. The first thing the commissioner said with the NURTW, they went on sensitization and said buses start carrying 8 passengers. The next day, the buses were all filled up.
Indeed. Abba, I believe, is on the line. Good morning, Mr. Abba.
Hello, good morning.
Good morning. Go ahead and try, please. We can hear you barely.
Okay, how are you? I've been watching the program
and I'm afraid this line isn't quite serviceable. I'm afraid, Mr. Abba, the line is not good. If you can hear us, we can't hear you. I'm so sorry about that. We'll see what we can do about it. The lines were good yesterday, maybe even today as well. But thank you very much for calling in, Mr. Abba, from Ebitemeta. See if you can, get back in. So, as we're saying, the gentleman in Abuja, he was explaining it, and one can empathize with him. But the part that I don't know if we're missing it or not is that the virus, Corona-19, is not allowing any quarters. I believe there's not a weakened strain that can operate around here because we have a weaker, health structure. It's going to be as potent, and
we'll now have a bigger problem in our hands.
Well, we hope not.
Because we have a poor health infrastructure.
Because one doesn't want to be alarmist. So maybe
those other countries, you can't say America, they don't have one of the best health facility. But look at New York.
It
took the US Navy to
being overwhelmed.
Bet and start helping.
Yes. They brought
the
ships
US Army,
to evacuate, patients
and all
so that to make room for hospital beds.
I think the government should start sensitizing people about the danger. We are not saying they shouldn't take. We are not saying they shouldn't take their 50 measures. They shouldn't go ahead.
But government tells us that it is doing that. We tell government this, but they say that they already are doing that. Maybe I'll put this question to Alhaji Lai Mohammed when we have him tomorrow. He's scheduled to come on tomorrow again to join us by Skype. touch wood, and all the technical wires are behaving themselves. Maybe we can put this again to him. There seems to, in all the agitations, including lawyers, you know, that are, and people, other commentators that are speaking about the legality or otherwise of shutting down, there seems to be at the back of people's minds the fact that, well, we are sort of, to some extent, immune to all of this, whereas they haven't said it outright, that you are fighting to go out there in the face of examples that we are seeing. And by the way, this whole matter of fake news, we have to be very, very careful about it again, because all sorts of stories are coming in that, well, you know, China has, you know, reportedly got rid of it, and now they are doing their damnness to make sure that they don't start reinfections. And so the regime for people getting into China now, and especially into Beijing, that is free and is hundreds of miles from Wuhan, you just can't believe it. So, but here we are opening up because we have to.
Exactly.
Let it be said. Because
and America,
we have to.
America, like virtually all the states, have confirmed cases. You know,
Well,
all the states, and you can't say America is not bigger than Nigeria. America is more bigger than Nigeria, more advanced than Nigeria. But look at the problem that they are carrying.
Yeah, but we still have to deal.
You know, so the government must. I'm not saying that the presidential task force, they are not doing a yeoman's job. They are doing, but they need to think it out properly. We are talking about lives. We are talking about lives. And they need to marry the two together. It's either they give us a 1 week grace period for people to either go out, rush out, get money, get food stuff, and then the next week they now tell people, sit down at home. Because even yesterday, I remember somebody was called in, and was saying that even the security personnel that were outside, they've started collecting money.
Okay, there you go. Well, let's come back. I think there's a call from Lagos Island. Oh, dear. Yomi, good morning, Yomi, in Lagos Island. Oh, thank you very much for calling in. Let's try. The line is terrible, as a matter of fact, but let's try. Oh, that's good. That's good. Please go on then. Okay, Yomi, thank you very much for calling in. You said you could hear me clearly, but we couldn't hear you, so it might well be in here. The problem might be once your call has reached here. If you can hear us clearly,
it becomes muffled.
Because it looks like it's strangulated. It looks like I don't know, if it were at home, you'd think of it as a cable issue.
Exactly.
You know, it sounds strangulated, but Yomi could hear us clearly. But once his call got in here, it's been a challenge. And what could you make of what Yomi was saying? I think he was commenting.
Yeah, he was saying that, okay, they are telling them to sit down.
Okay.
He doesn't have lights.
Oh, okay.
He doesn't have, and things like that. These are some of the things that the government should have, sat down to think about. Electricity. Even there was just on the first.
How is government
they even tried to
how is government going to think about it when the first time we heard about this coronavirus was December? Late December last year. From December last year, when we ever first heard about it and didn't think of it seriously, till
on February when it
now dawned on us. And these are issues that have been with us: issues of education, issues of healthcare development and structure. What is government going to do? It's like some people are even saying, perhaps judgmentally, that the chickens have come home to roost.
Exactly. So
the chickens have now come home to roost.
And now they have to deal with it, because but
we're still caught in the middle. Yes. We, the ordinary people.
That is why we have to help ourselves, because the government can only do what they can. Yes, we
It can't do more than it can.
Yes, no, because if they can only sit down and try and review the strategies that they have, and it is left for us, the citizens, to either take it or we don't take it. But the only way we can do as citizens is for us to, if we really, really want to survive. Because I've seen pictures, I've seen videos. Every day, if I leave this office, the next thing is, sometimes it's just like, I was just coming this morning, I was just like, should I even stop watching TV?
Yeah, it gets that bad. But government is trying to put a human face on it, no doubt. And government is also listening to feedback that they're getting. And this feedback is not coming from people who know, in quotes. It's coming from the valuable segment of our society that is in the majority, and somehow, even without saying so, seems to be indicating that it feels immune to some extent. By which I mean that I can come out, I can go out, and I won't pick up something that can be potentially lethal. So we've completely run out of time. I don't know. I don't know if we can take anybody else. Is that the idea? Do they want us to take someone? Okay, so that's it. That's our program today. We're going to have to leave it, but again, leave it with the council that we should please do everything that we can, at least in terms of our personal hygiene. And
wash our hands.
And also bear in mind the social distancing thing. Whether you want to comply or can comply or not, just bear it in mind that these are the best practices from around the world. It doesn't cost any money.
Exactly.
Wash your hands, soap and water. The sanitizer is even secondary. And then the social distancing thing, no shakes, no hugs, cough in the right way, sneeze in the right way. And let's leave it there for now, at the very base, simplest kind of way. Thank you very much, Asukwa James, TVC News Assignment Editor. That's our program. Please join us tomorrow for a fresh edition. And do stay safe. I'm Yori Folarin. Bye-bye for now.